Hi, sometimes you come across a term, heparin lock or hep lock or saline lock, and you wonder what does that mean. I'm going to talk about that today. So, these terms come to use when you are thinking about strategies to keep your central lines or IV access open. So these are strategies that are used to keep them open or to prevent blood clots from happening within the IV access. So it's just a simple term. It's just that if you are not familiar, you are not familiar. So let's pretend that this is our IV access. This is the line, the catheter, and then this is the connector attached to it. So now when you are talking about a saline lock, what you mean is that you put saline inside this connector. So saline sits in this connector to keep it patent or to prevent blood clots, because there are times when you in this connector you see that blood will back up. Let me raise it up. Blood will back up and sit in this connector. And what do you think will happen when blood is just sitting here? It will clot, and then it can block off the catheter which is sitting in the vein. So when you do a saline lock, what it simply means is that you take a flush of saline and then you push it inside, and then what you have sitting in here is saline rather than blood. So that is what a saline lock means. So it is one strategy to prevent clotting or clogging of your IV access. Another strategy that is similar to it is the heparin lock. So in this case, rather than putting just a plain normal saline, this is normal saline inside here, what you do is you put heparin in a solution. It looks something like this. This is 5 ml, and usually they inject 3 ml for peak lines, I believe. Then for CVCs or central lines, I think they put the whole of the 5 ml inside. So instead of blood or normal saline sitting here, you now have a solution of heparin sitting here. Note that this heparin is not the same concentration with the heparin that you are used to giving the patient, whether subcutaneous or otherwise. It is a lower concentration of heparin. I believe this one is 10 units. This is 10 units of heparin. So that is what heparin lock is. That's you're locking the line with heparin. For saline, you're locking the line with saline. So that is what it means. This is another. Let me see, what is this one? This is also heparin lock. Maybe a different concentration. So they come like this in these colors. When you see these colors, you know that it's not a normal saline flush. But for the saline flush, you see that the cap is white. So learn to differentiate them. The cap is white here, and these ones are usually 10 ml. Though we have 5 ml for this one. This one I see, these ones are 5 ml. So that is it. For the central lines, you can keep that. You can keep the heparin lock for 24 hours. And if you have 2 or 3 lumens, for instance, if you have one lumen here, another lumen, each of them have to be treated with, you don't just do one and leave it. You treat each of them with the locks if you want to lock all of them. Then another term that is similar to them and is also a strategy for keeping the vein open is what you hear them call KVO. That's keep vein open, KVO. Another way of saying it is TKO, to keep open. So when you see those terms, that's what they mean. And in the case of KVO, what is done is that a very small quantity of infusion will be allowed to go through the patient's catheter. So just like maybe if you are giving normal saline 75 ml an hour, for KVO you give a small portion, maybe 5 ml, 10 ml. So just a small volume of normal saline is going through the vein continuously to keep it open. That's what KVO means. Now, hospitals have different protocols for the heparin lock, saline lock. Make sure you follow your hospital protocol. Make sure you read up on it, know what the hospital wants you to do, and do it. For the KVOs, some hospitals go as far as prescribing a rate. So make sure at all times you work with your hospital policies. Thanks for listening. Like, share, subscribe, and follow for more.